As an ICU nurse, I watched a patient literally kill himself by ignoring medical advice. I was a nurse for over 20 years, and I was shocked to learn that most people have no idea how to properly take care of themselves. I once had a patient who was in his 50s and had a heart attack. He was in the ICU for a few days and then moved to the cardiac unit. I was his nurse for the day, and I was going over his discharge instructions with him. I was explaining the importance of taking his medications, eating a healthy diet, and exercising regularly. He looked at me and said, "I don't need to do all that. I'll just take my pills and be fine." I was shocked. I explained to him that the pills were important, but they were not a cure-all. He needed to make lifestyle changes to prevent another heart attack. He just shrugged and said, "I'll be fine." A few months later, he was back in the hospital with another heart attack. This time he didn't make it. It was so frustrating to see someone who could have prevented a second heart attack if they had just listened to their doctor. I saw this happen over and over again. People would come into the hospital with preventable conditions, and they would leave without making any changes to their lifestyle. It was heartbreaking.